Welcome to part 2 of my series where you will learn how to keep your vagina healthy and stop spending money on expensive pills and creams that don't work. In part 1, we covered 5 key tips to help you achieve a healthy vagina. And if you've not watched it yet, the link is in the description box for you. For those who have though, I've got a question for you. Which is more important, your vagina smell or its acidity? Let me know what you think in the comment section, and if you can't get it or you're not sure, the answer is in part 1's video. The 6th tip is that not every vaginal discharge is abnormal. So it's normal to have a vaginal discharge every day. But what is normal? So the vaginal discharge is a small quantity of fluid or mucus-like material that you might find on your underwear every day or every other day. Often it looks white in color or it might be clear without an offensive smell. It's made from fluid and mucus that's produced in the vagina itself and from the cervix. It also contains some dead cells or tissue and some of those germs that live in the vaginal canal. When your vaginal fluid or discharge is exposed to air, it might change color to look a little bit creamy or yellow. And for some ladies, because it's also a little acidic, it might affect the color of your underwear, causing stains or bleaching the fabric. Apart from keeping your vagina clean, this discharge also helps to keep it supple and elastic. So you have no reason to panic about a slight amount of colorless, non-smelly vaginal discharge. In addition, the nature of the discharge changes depending on what is happening in your body. For most of the menstrual cycle, the discharge is thick and sticky, but close to and around the time of ovulation, it becomes clearer, wetter, even thinner, and stretchier like egg whites. And this is part of your body's natural trick to encourage sperm to move quickly and lead to fertilization if you've had sex around that time. When you're pregnant, the amount of the discharge can also appear heavier. Stress, hormonal imbalances, some antibiotics, and some types of birth control like the pill or the coil can also cause excessive amounts of vaginal discharge. Anything else, smelly, an odd color, itchy, or very, very heavy should make you seek your doctor's advice. Now, opposite to this is my tip number 7, vaginal dryness. So this is not just an experience of perimenopausal or menopausal women. Although, yes, of course, it's quite common amongst these ladies because of the lower estrogen levels during that time. But some studies suggest that over 15% of non-menopausal women have vaginal dryness from different causes. For younger women, using the birth control pill or other hormonal birth control methods also cause hormonal imbalances that can sometimes lead to vaginal dryness. Other causes of vaginal dryness are things like breastfeeding, medical conditions like diabetes, cancer treatments like chemotherapy or hormone therapy, having the ovaries removed, for example, in a woman who's had a hysterectomy, some vaginal washes and douches, as well as low libido or loss of sexual desire. Apart from birth control pills, some other medicines can cause vaginal dryness. For example, some antidepressants and some antihistamines. This is important for those of you that suffer from hay fever. Other drugs like anti-estrogen that's used for treating endometriosis or fibroids could also fall into the category of causing vaginal dryness. Vaginal dryness is unpleasant, it's painful, and can lead to bruises or cuts in the vagina, which can then go on to cause infections. Luckily, detecting the causes will help to treat it, and there are many lubricants and moisturizers, estrogen replacement pills or creams, and some natural oils that can help deal with vaginal dryness. So watch out soon for a separate video where I'm talking about vaginal dryness, and we'll be discussing this in much more detail. If you are still having kids and you're using natural oils like olive oil, coconut oil as an external lubricant before sex, be careful because these oils can damage condoms. Now on to tip number 8. Speaking still about sex. So apart from vaginal dryness, there are some other sex-related issues that could affect your vaginal health. And I'm speaking about birth control methods like condoms or diaphragms. Yeah, I can see that you're surprised by this. But remember, some ladies can be sensitive or even allergic to the materials that they use to make these condoms or diaphragms. All that can lead to vulval and vaginal irritation. So just be careful if you already suffer from sensitive skin. And what about anxiety or previous traumatic sexual experiences? These can lead to low arousal or pain trying to have sex. Clearly, these will irritate the vagina and make an already bad situation worse. Identifying the problem early, seeking help from your doctor or a sex therapist can help you look into these issues to get the relief that you need before things get worse. Tip number 9 is to strengthen your pelvic floor. Your pelvic floor is the sheet of muscle inside the lower half of your body that holds up or keeps in place your pelvic organs. These include the bladder, the womb, anus, and rectum. Just like any other muscle, your pelvic floor can become weak, which makes those organs sag or drop. Now I can hear you asking, what does that have to do with the vagina? Sometimes when this happens to the womb and it drops, by the way, we call this a prolapse. Part of the womb can jut into the vagina. If you've experienced this before, you will describe feeling something like a lump or a bulge coming out of your vagina. Now, many of us lose the strength of our pelvic floors when we have babies or we put on weight or experience procedures like an episiotomy during delivery. You can prevent damage and weakness to your pelvic floor by carrying out specific exercises known as Kegel exercises and by maintaining overall health. Check out this video here where I talk about your pelvic floor, everything you can do to help to support it and keep it healthy. This is also my opportunity to speak to my ladies who are pregnant or about to have their babies very soon, particularly via the vaginal route. An episiotomy is that cut in your genital area or perineum that is usually given during labor when your baby's head is about to emerge from the vagina. In some ladies, that opening, that space may be too tight, and the cut helps to ease the baby's head through and prevents mom from sustaining a tear if the baby's head comes through too quickly and forcefully. A tear like that can be more difficult to heal or treat than a cut. In this video here, I talk about different ways to deal with an episiotomy. So please check it out after watching this one. And that brings us to tip number 10, which is, what are the signs of vaginal problems that should make you concerned and seek advice from your doctor? We've looked at some of them already, but here is a list of possible symptoms that should alarm you and get you to schedule an appointment to see your doctor to examine and determine what might be causing those changes. Many of them are treatable, and it's important that you get them looked at sooner, because if not, they could become complicated and cause even worse problems down the line. Number 1, experiencing painful sex. Number 2, if you notice any redness of the vagina, a rash around your vulva, or you experience itching in the same area. Number 3, feeling a lump, a mass, or something that's bulging into the vagina. Number 4, you notice a change in the color or the smell or the amount of discharge that's coming from your vagina. So if you've got to this point of the video, thank you for sticking around with me to the end. Please give it a like and share it with a friend. Don't assume that we all know these things. Make sure you subscribe to the channel. Check out my women's health playlist for more educational videos just like this, and I'll see you again soon.